Are your symptoms a sign of PCOS? Polycystic Ovary Syndrome, commonly known as PCOS, is a hormonal disorder that affects many women of reproductive age. If you are experiencing certain symptoms, you might wonder if they could indicate PCOS. Understanding the signs and diagnostic criteria is crucial for clarity. One of the hallmark symptoms of PCOS is irregular menstrual cycles. This can manifest as having fewer than 9 periods a year, experiencing cycles that are longer than 35 days, or having very heavy or prolonged periods. These irregularities often point to issues with ovulation, which is vital for fertility. Another key sign is elevated androgen levels. Androgens are often referred to as male hormones, and when they are elevated in women, they can lead to physical symptoms such as excessive hair growth on the face, chest, or back, a condition known as hirsutism. Other signs include severe acne, oily skin, and male pattern baldness or hair thinning. Additionally, polycystic ovaries may be observed during an ultrasound. This means that the ovaries appear enlarged and contain multiple small follicles, which are often referred to as cysts. However, it is important to note that having polycystic ovaries alone does not confirm a diagnosis of PCOS without the presence of other symptoms. To receive a diagnosis of PCOS, a healthcare provider typically looks for at least 2 of the following criteria: irregular ovulation or menstrual cycles, clinical or biochemical signs of excess androgens, and the presence of polycystic ovaries on ultrasound. Other symptoms that may accompany PCOS include weight gain, particularly around the abdomen, and challenges with conception due to irregular or absent ovulation. Symptoms often begin around the time of the first menstrual period but can develop later in life. From a fertility perspective, PCOS is a common cause of anovulation, which is the lack of ovulation that can lead to infertility. While PCOS can complicate the process of conceiving, many individuals with PCOS do manage to conceive, either naturally or with medical assistance. Treatments may include ovulation induction medications or assisted reproductive technologies like in vitro fertilization. If you notice symptoms such as irregular or absent periods, excessive hair growth, acne, or difficulty conceiving, it is essential to consult a healthcare provider. They can conduct a thorough clinical evaluation, perform blood tests to check hormone levels, and conduct a pelvic ultrasound to determine if PCOS is present. This will help in developing a tailored treatment plan that aligns with your fertility goals. In summary, symptoms that may indicate PCOS include irregular periods, signs of high androgen levels, and polycystic ovaries on ultrasound. Given the complexity and variability of PCOS symptoms, seeking professional medical evaluation is vital for accurate diagnosis and effective management, especially when fertility is a concern.